Hello, namaste to all of you. This is Name-Shalu from Department of Physiotherapy and Diagnostics from Jaypur Vidyapeeth University. So, for today's topic, I will be discussing about introduction and collection of your urine sample. So, in regular laboratory diagnostic tests, we usually perform blood tests. First of all, blood test, which is your serum or plasma test, which is your so first of all glucose, fasting, PP, your KFT, your lipid profile, your TG, cholesterol, and LDL, HDL ratios. So, next, apart from your blood test, we perform urine test. So, urine test, it is a non-invasive test. So, it is safe to perform. And in order to perform urine test, there has to be various parameters that has to be taken care of from collection to analysis of your urine sample. So, what is a urine? It is typically very, first of all, sterile liquid, and the byproduct, it is one of the byproducts of the body and is excreted by your kidneys through a process called as urination and excreted through your urethra. So, urine, it is often used as diagnostic feature for many disease conditions. So, these may be based on either physical or chemical components. So, that may give insight to processes within the body. So, often through urinalysis, a common clinical analysis of urine. So, urine, which is a liquid excrement, it consisting of water, salts, urea, and which is made up in your kidneys, and it is then released through your urethra. So, what is urinalysis basically? So, urine analysis, the word itself says like urine and analysis. So, urinalysis is routine and microscopic, R and M. So, when you'll be looking at your lab diagnosis, so when a doctor prescribes urine test, he will write it as your RNM, urine test RNM. So you have to perform, if he writes urine RNM, so you have to perform the routine test, routine test for urine, and your microscopic examination. So it is an array of tests that are performed on urine, and it is one of the most common methods of your medical diagnosis. Now, there are different types of urine specimens. So, over the course of 24-hour period, the composition and concentration of urine changes continuously. So, for this reason, various types of specimens may be collected. So, including first one can be your first morning sample. So first morning sample specimen is your sample where the patient is given the urine container, and he or she is told that when you get up in morning, just and when you have the urge to urinate, so you have to collect that first flow of your first morning sample. Now, this is your first morning specimen. The other sample that is collected in case of urine is your single random specimen. So, a single random specimen, it can be collected at any point of your day. So, at a random point of time, you can collect your specimen. And by the word single, I mean it is a one-time test. So, you have to collect only once, not your whole day or at particular time. So, it is a single random specimen. So next is your time or short-term specimen. So time like you have to for a brief period of time. So we can say either for the whole morning routine or within your evening routine, you have to collect short for a short period of time. You have to collect multiple samples, and the other is your time long-term specimens. That is, it is a full day specimen you have to collect, like for whole 24-hour specimen is collected. So for the whole day, whenever you're going for, you have the urge to urinate, you have to collect the sample. So it is basically to always to first of all to check obviously whatever the what are the constituents of your urine. Also, it is also to quantify the amount of urine that you are excreting for the whole 24-hour time period. Now, there is catheterized specimen or specimen from an indwelling catheter. So, in case patients, if there is some blockage or when there is some need to test some specific parameter. So catheter is inserted and the sample is collected through your catheter within your catheter, and that sample is tested for your uh, several biological parameters. So catheterization of specimen or specimen from your indwelling catheter. So next is your double voided specimen. So this double voided specimen, it is used for your test of your sugar and your acetone. And last is your clean catch. So or midstream specimen. So mostly in case of in most of the tests, we collect mid-stream specimen. So what is mid-stream specimen? The patient is basically told to discard your first first flow of your urine sample. And in the midstream sample, has to be collected for your urine culture and your cytological analysis. So the first voided morning sample is particularly valuable because it is more concentrated and abnormalities they are easier to detect. Now, an early morning specimen, which is also relatively free of your dietary influences and also changes due to physical activity. So, in collecting any urine specimen, it is always important for nurse to observe specific agency protocols. So, to check with a laboratory regarding the need of for refrigeration or preservation, like by any chance, in any case, if you have time for your sample to be delivered to lab, or if in lab you're not performing test immediately, so you have to always refrigerate it. Why? Because our samples they contain some biological molecules, or they contain bacteria which multiply and they affect your urine sample, and the parameter that you want to measure, that will be affected and you won't get the correct test results. So single random specimen, they may be taken at any time of the day or night, and timed specimens range from short term 2-hour collection to the 24-hour collection. So, 24-hour urine specimen, it is an extremely important diagnostic test because it reveals how kidney adjusts to changing physiological needs over a long period of time. So, substances that are excreted by the kidneys, they are not excreted at the same rate or in the same amount during different periods of the day and night, and therefore a random urine specimen, it does not accurately represent the processes taking place over a 24-hour period. However, a 24-hour urine specimen is useful only when all the patient's urine is collected for 24 hours. So, even if just one sample is discarded, the result will be inaccurate. And the nurse, they must ensure that the patients in all assistive personnel understand the importance of saving all the urine. So, to begin the 24-hour collection, the person has to void and discard the urine already present in the bladder, and then all the urine starting with next voiding is collected for your next 24 hours in a big, large container. Now, this large collection bottles are used for collection of a 24-hour sample. So, to prevent the breakdown of urinary components, the collection has to be preserved and added. Also, these specimens need to be refrigerated. Now, um, collection of specimens, the laboratory needs at least 10 ml of urine for a routine urine examination. So the perineal area in women or the end of penis in men, they should be cleaned before urine is collected. So for a female collecting midstream urine, it lessens the because in female there has to be collection of midstream specimens. So the contamination from vaginal secretions, so it and menstrual flow, it there's less chance of this contamination. So wiping the genitalia with sterile wipe may stimulate the voiding reflexes in infants. So various collection bags, they can be used or they can be attached to the genitalia of infants or small children. So a cotton ball in a diaper, it can be used to for quick collection of urine or for a dipstick testing. So if a culture or sensitivity are to be completed, so in addition to the routine urine analysis, the urine specimen, they must be placed in a sterile container. So if the container is not sterile, so it will interfere with your results. So maybe this container has some contaminations which shows up in your results, and you'll have the wrong interpretation and wrong analysis or wrong diagnosis. So urine specimens, they need to be examined within 2 hours because most of your biomolecules, they start breaking down after or within 15 minutes or within an hour. So urine that has to be left standing for too long, it becomes alkaline because bacteria, it begins to split the urea and the contained in urine into ammonia. So a visualization of urine and other tests are inaccurate. So if pH of urine specimen has become highly alkaline, a urine sample should be refrigerated, and if it cannot be sent to the laboratory within 2 hours. So for a urine test, these things has to be kept in mind. So how to collect the specimen and how to store that specimen. Collection and storage part is very important. So if you're not performing your test, you have to either first of all you have to immediately transport it, collect and transport the sample from collection center to the lab, and for by any chance, if you're not performing your test immediately, you have to refrigerate it uh, under minimum 4 degrees Celsius temperature, and still you have to perform your test as soon as possible. So this was it for introduction, collection, and storage of urine. For next lectures, I'll be telling you about physical and chemical examination. What will be your interpretations and what will be your results for urine collection. So this was it for today. So we'll meet in next class. So until then, if you have any issues related collection and storage of urine, you can contact me. And until then,